What is strep throat? A bacterial infection called strep throat causes inflammation and pain in your throat. Group A Streptococcus bacteria is responsible for this common condition. All ages can get strep throat, including children. It's most common in children aged 5 to 15 years old. The infection can be spread by coughing or sneezing. Strep throat symptoms. There are many factors that can affect the severity of strep. Some people only experience mild symptoms like a sore throat. Some people experience more severe symptoms like fever or difficulty swallowing. These are the most common signs of strep. A sudden fever, especially if it is 101 at F, 38 at C or higher. A sore, reddened throat with white patches. It can cause headaches. Chills. A loss of appetite. Swollen lymph nodes in neck. Trouble swallowing. These symptoms usually appear within 5 days after the patient has been exposed to the strep bacteria. Learn more about strep throat that doesn't require a fever. How contagious can strep throat be? The highly contagious bacterial infection strep throat can be fatal. It spreads via small droplets in the airways that are released when someone suffering from streps has a cough or sneezes. Causes of strep throat. Streptococcus pneumonia, also known as Group A Streptococcus, is the bacteria that causes strep throat. If you touch your eyes or nose after being exposed to the bacteria, you can get strep. Strep throat is spread by sharing food or drinks with an infected person. Strep throat can also be contracted by touching an object contaminated by Group A bacteria, such as a doorknob, faucet, and then touching your eyes or nose. Strep throat risk factors. There are several risk factors for tonsillitis or strep throat. Young age. Children aged 5 to 15 years old are most likely to get tonsillitis from bacteria. Frequent contact with other people. Children in daycare or school are often exposed to germs. Tonsillitis germs may also be more common in people who live and work in urban areas or use public transport. It is the time of year. The most common time for strep throat is in the fall and spring. Tonsillitis can only be caused by tonsillitis. Diagnoses of strep throat. If you have any of these symptoms, consult your doctor. A sore throat that persists for more than 2 days. A sore throat that has white patches. Dark, red spots or splotches on the tonsils or top of the mouth. A sore throat that produces a pink, sandpaper-like rash on the skin. Trouble breathing. Trouble swallowing. Your doctor will check your throat for inflammation and examine you. Your doctor may also examine your neck for swelling and ask you about any other symptoms. A rapid strep test may be performed in the office if your doctor suspects that you have strep. This test will determine if your sore throat is due to a strep or other type of bacteria. The doctor will take a sample from your throat using a cotton swab. The lab will then examine the sample for any signs of bacteria. Results are available within 5 minutes. Your doctor may send your sample to an outside laboratory for further testing if your rapid strep test results are negative. These results will be available in a matter of days. Treatment for strep throat. Your doctor will prescribe antibiotics to treat strep. These antibiotics prevent the spread of bacteria and infections. There are many types of antibiotics available. To kill the infection, it is important to complete your antibiotic treatment. Sometimes, people quit taking their medication if they feel better. This can lead to a relapse. The symptoms may return if this happens. Amoxicillin and penicillin are the most commonly prescribed medications for strep infections. Your doctor may prescribe azithromycin if you are allergic to amoxicillin or penicillin. Home remedies for strep throat. There are also at-home remedies that can be used to relieve symptoms of strep. These include drinking warm liquids like lemon water or tea. Drinking cold liquids can help to numb the throat. Turn on a cool mist humidifier. Take over-the-counter pain reliefs such as acetaminophen or ibuprofen. You can chew on the throat lozenges. Gargling the mixture by adding ½ teaspoon salt to 1 cup water. Honey and apple cider vinegar are natural remedies that may help. Prevention of strep throat. There is no vaccine that can prevent strep throat. Regular hand washing is one of the best ways to prevent infection. You can also use a hand soap if you don't have access to soap or water. Do not share food or drinks with anyone suffering from strep throat. Share towels, sheets and pillowcases with someone who has strep. Use hot soapy water to wash dishes and launder laundry. Strep throat can be treated by sneezing or coughing into your elbow, or into a tissue. Wash your hands often.